Dr. Lalit Chimpi is a consultant gastroenterologist and digestive disease specialist. He is practicing in Pune for last 10 years. He is attached in Jahangir Apollo Hospital, Sahyadri Hospital, Dinanath Mangeshkar Hospital and MZM Hospital, and has his own specialty clinic on Bhandarkar Road in central Pune.
28th of July is celebrated as World Hepatitis Day all over to increase awareness amongst patients and amongst the public at large about this dreaded disease which is called as hepatitis. Hepatitis is basically means inflammation of the liver. It can be caused by various diseases, and common amongst them in our country are viruses, namely hepatitis A, hepatitis B, C and hepatitis E. Hepatitis A and E are responsible for acute hepatitis in most of the cases, while chronic hepatitis is caused by two viruses, namely hepatitis B and hepatitis C. Infection with hepatitis B and C is the more dangerous form of hepatitis because once these infections become chronic, they can lead to liver cirrhosis, liver failure, and ultimately patients die of liver cancer in many of these cases. There are a few questions which come to our mind as far as hepatitis B and C are concerned, and I'll try to address these questions. How can you get hepatitis B or hepatitis C? So hepatitis B and C are basically infections which are blood-borne. So one can get infected by when you have contact with either blood or with body fluids which are infected with hepatitis or B or hepatitis C virus. Hepatitis B and C are transmitted via infection, via blood or blood products, or via exposure to body fluids which might be infected with these viruses. So common methods of infection of hepatitis B and C are, for example, people who are doing IV drug abuse, or people who have sexual contact with infected people. It can also get transmitted from the mother to the baby if the mother is infected with either of these viruses. Sometimes you have patients who are on chronic hemodialysis, and such patients are exposed to infected machines or instrumentations which might be infected with hepatitis B or C. So these are the generally causative factors or ways in which hepatitis B or C are transmitted to an individual. So who are at risk for hepatitis B or C infection? If you are, as I mentioned previously, a baby born to a mother who is infected with hepatitis B can be infected with hepatitis B. Injection drug abusers can be infected. Sexual partners of people who are infected are at very high risk for developing hepatitis B or C, similar to what you would expect with, say for example, with HIV infection. Many healthcare workers, for example doctors or technicians in laboratory or nurses, are at higher risk for getting infected with these viruses because they are constantly exposed to patients who are infected with hepatitis. How do you know if you have hepatitis B or hepatitis C infection? Unfortunately, the symptoms and signs of hepatitis may vary a great deal amongst individuals. If you have acute hepatitis, commonly known in layman terms as jaundice, then you will have symptoms like fever or loss of appetite, muscle pains, joint pains, and then this is followed by yellowish discoloration of your eyes or of the urine, and this is what we call in layman terms as jaundice. Now this is the presentation of acute hepatitis, which is more common in viral infections like hepatitis A or E. Unfortunately, people who develop hepatitis B and C, which are the more chronic forms, they may not have any symptoms at all, and the infection because of the virus may be silently going on inside the body, inside the blood and in the liver, and one might be completely unaware. Of course, when one develops serious diseases or liver failure or chronic liver disease or cirrhosis because of these hepatitis viruses, then the symptoms of end-stage liver disease are common, which your doctors can recognize, and these may be in the form of either jaundice or swelling of the feet or fluid developing inside your abdomen, which is also called ascites, and that is probably a late stage when these infections have already caused their damage to a great extent. So what are the precautions that you can take if you want to prevent transmission or prevent getting hepatitis B or C? The first thing is avoid sharing needles. Make sure that when you visit your doctor, he is using disposable needles, disposable syringes, so that you don't get inadvertently infected because of a previous patient. avoid IV drug abuse, because this is one of the commonest causes for hepatitis B and C, and it is very common, for example, in northeastern states of India, where it was quite common to get these infections via drug abuse. So as far as possible, try to avoid that also. If you are going for tattooing, for example, then that is sometimes a cause for these bloodborne infections, especially hepatitis C, if one is not aware. So try to see that the person you are going to is using all disposable instruments as far as this is concerned. Healthcare workers, of course, have to be very careful when they are handling patients, when they are handling instruments, and it's always a good idea to use disposable instruments when you are performing procedures. Vaccinations are available for hepatitis B, unfortunately not for hepatitis C, and all healthcare workers, nurses and technicians should have got themselves vaccinated. If you have any household contacts, or if you have anyone in the family who's infected with hepatitis B, it is recommended that everyone in the household should be vaccinated for hepatitis B. One should avoid using razors or using toothbrushes which have been used by such kind of patients, because sometimes that can also transmit infections to you. Hepatitis B has now been included in the universal immunization program. So ideally all newborn babies today are compulsorily vaccinated for hepatitis B by their pediatricians. If you are not really sure about whether your baby has received vaccination, then one should always consult your pediatrician and make sure that your baby has been vaccinated, so that he or she doesn't get infected in future. Unfortunately, hepatitis C does not have any vaccine which is available to date. There is a lot of research going on in hepatitis C vaccination, but we still don't have vaccine. So using universal precautions and using precautions to prevent getting infected in the first place is the best way to. People often ask whether there is a cure for hepatitis B or a cure for hepatitis C. For an acute infection, actually no treatment is required. If you have an acute hepatitis B or C, or even an acute hepatitis A or E infection, then it is a self-limited disease. So no treatment specifically for the virus is required. Admission may be required. You might require IV fluids, vitamin supplementation, some liver supportive medicines, and most of the times your hepatitis will get cured just with the supportive therapy. For chronic hepatitis B, there are drugs which are available which will reduce the load of the virus in the blood, and it will reduce replication or the multiplication of the virus, so that the damage to the liver is minimized, or the damage to the liver does not occur. Once you get infected with hepatitis B, that is you are HbSAg positive, it is very rare that you will actually lose the virus. But most of the times it's not important that you lose the virus. What is important is that the infection is controlled and the liver damage is prevented. Even if we achieve that, that is good enough for us to have a long and healthy life. Hepatitis C can be, as we say, cured now with many of the medicines which are available in the market. And if you receive a course of injections for hepatitis C for either 6 months or 12 months, depending on the kind of virus that you have, then most of the times if you get a good sustained response to these medicines, then the disease is deemed to be cured and you don't need any further therapy. What if you are already infected with hepatitis B or hepatitis C? In that case, of course, in addition to whatever treatment that you receive from a doctor, one should take care that to see that you are not exposed to other problems which can also affect the liver. So it is a strict advice not to consume alcohol even in small quantities if you are infected with hepatitis B or C, because you don't want two things to damage your liver if you already have something which is already damaging the liver. Before taking any medications for any minor problems, it is always a good idea to consult a doctor, so that inadvertently you don't take any over-the-counter prescriptions from a pharmacist which may damage your liver, since it's already infected with these viruses. Frequently patients ask us whether there is any restriction as far as working in certain occupations is there if you are infected with hepatitis B or C. Many of us, or many of the people, are asymptomatic carriers who don't need any treatment, they just need monitoring. And if you are an asymptomatic hepatitis B carrier, there is no reason why you should not be accepted into any job as long as it does not involve the healthcare facility. So if you are a lab technician or a nurse, or you are planning to go into the medical field as doctor, yes, there might be some restriction if you are hepatitis B positive, in order to prevent you transmitting infections to other patients. But otherwise, in all other jobs which don't involve the healthcare, there is no need for you to be denied occupation just because you are hepatitis B positive. The liver, unfortunately, is a very tolerant organ in our body, so it will not give you any signs and symptoms of these chronic diseases like hepatitis B or C until the disease reaches an end stage. So, at the end, I would like to just say that prevention is better than cure. So, instead of getting worried after you have got infected, it is best that you see that you are not infected in the first place by these hepatitis viruses.